Welcome back to Village in Motion this Wednesday, July the 11th. I am Clint Lambert, and it's my pleasure for this segment of the Village in Motion today to have in the studio with me Tai Gorecke, and she is a speech language pathologist. And if you don't know what that is, we're going to ask her about it, okay? Welcome, glad to have you with us.
Thank you for having me.
Very first question,
Okay.
What is a speech language pathologist?
So speech language pathologists, they can work with adults or children. Typically
Okay.
you think of, oh, they're the speech teacher, they're in the schools.
Okay.
But we do more than that. We also work with adults, ranging from issues with traumatic brain injuries, strokes, swallowing disorders, and we help people with their language, communication,
Okay.
what they understand, what you can express, are two different skills.
Right.
Their speech, so if someone had a stroke and they're having difficulty communicating, slurring their words, it just doesn't sound like them.
Right.
We help with that. Voice, so if your voice is quiet and you're hard to hear, for example, Parkinson's patients.
Right.
I'm trained in a program called Lee Silverman Voice Treatment, the Big and
Okay.
Loud program. So we also do we can do that with home health, as well as it's also an outpatient therapy.
Okay.
And then also with memory, problem solving, and safety awareness, because we want to make sure that if you're getting kind of forgetful and it's a new thing, we can come in and help you with that and keep you independent at home. That's a lot of what I want to do with people
tremendous.
is keep them independent as they want to be in the home.
Very good.
And then some people also have trouble with swallowing. Say you go to the hospital, you're there for a month, you're very weak, or you had a stroke, and you have swallowing difficulties. You can come into the home, provide suggestions, recommendations, because you're in the home, it's
Right.
always your choice, about how to eat and drink safely,
Oh, okay.
which is very important.
And so you're providing those services here to the residents of Green Spring, right?
Yes, via home health.
Okay.
And then I also help out in rehab at Garden Ridge sometimes, but my primary position is with home health.
Okay. How long have you been with us?
It is 2 years now.
Oh, wow.
Yeah, 2 years this month.
Okay. I've never seen you, had the pleasure of meeting you.
Oh,
so
okay.
I'm glad you're with
Usually
us.
people see me in the hallways walking around. Yeah, I've been a speech language pathologist for 3 years. When I graduated, I started in private practice with pediatrics, and then I moved to a skilled nursing facility until I started here in home health. Prior to that, I was in the Navy for 10 years,
Okay.
surface warfare officer, and operated nuclear reactors.
Oh, okay.
So traveled the world.
So you've had the hot stuff.
Yeah, it's actually very boring until it's exciting.
Yeah.
You sit there, you monitor everything,
Right.
and then everything can break loose.
Right. Well, there's a lot of ex-military here. I spent 10 years in the Navy, but I spent 4 years in the Air Force and 6 years in the Army.
Oh my
on either
goodness.
end, so.
Moved around.
Yes. But very glad to have you here with us and providing this service. How do we get to you? How do we use your services?
So we have a coordinator with the hospitals that can do referrals for home health, provide the order, and then we make a phone call and say, hey, we'd like your doctor has ordered home health therapy. We'd like to come and see you on this day to
Okay.
do the start of care. Or residents that haven't been to the hospital, but they're experiencing difficulties at home, their weakness, or having trouble getting out of the apartment, they can go to their doctor here at Green Spring or any primary care doctor
Okay.
and request home health therapy.
Okay.
We have nurses, physical therapists, occupational therapists, and a speech language pathologist.
So you're the only speech language pathologist?
Yes. And I
Okay.
do have someone that helps me, like if I'm on vacation.
Oh, okay.
But then we can come in. It's nice because you don't have to leave. You have to be homebound.
Okay.
So Green Spring is your home.
Right.
But it needs to be tiring, leave the home infrequently, things like that. If you're driving and going to the grocery store
Okay.
multiple times a week, then
But is
outpatient
homebound
therapy.
considered the fact you stay within the confines of Green Spring, or you stay within the confines of your apartment?
It's different here. Green
Okay.
Spring is your home.
Right.
So we take that into
So
consideration.
anywhere you can go anywhere within
in
Green Spring.
But
Okay.
again, it has to be like a taxing, tiring effort. Like
Right.
you're not able to do the things that you normally do.
Okay.
And then obviously doctor's appointments
Right.
are always okay,
Okay.
here on campus or off campus.
All right. if an individual has problems with speech, how many times do they see you? What's the routine?
So I would come in and do an evaluation and determine what meets the person's needs.
Okay.
Sometimes people are a little overwhelmed by having nursing, physical therapy, occupational therapy in the home.
Right.
So it depends on the person's needs. So like if they're really concerned about making sure they can get up and walk and move around the apartment, then I might come less frequently at the beginning until they regain their strength. And then it becomes less overwhelming to have so many people in the home. But typically 2 times a week, and then the length of time varies on the person. It could be 2 weeks, it could be 4 weeks, it could be 6 weeks, depending on the person's needs.
All right. All of this has to be approved by a physician. So are you reimbursed then by Medicare? And
yes, that's a great question. This is part of your Medicare Part A benefit.
Okay.
So we always have an admission consent form, and we show that this is 100% covered by Medicare and that the resident pays $0.
Oh, okay.
Which it's a fabulous service.
Yes.
It keeps people in the home safely. We coordinate closely with the local social workers. If someone's losing a lot of weight, I'll speak to the resident about having one of the dietitians come in and speak with them. We really communicate with a lot of people to try to provide the best care possible.
So the resident has no copay?
Correct. No copay. They pay $0.
Wonderful. That's excellent. In and of itself.
Yeah, and then if someone continues to need therapy after they've regained a lot of their strength, they're feeling better,
Right.
and then we, if they would like us to, we can refer to outpatient therapy. We send the request to the doctor, and then the doctor is able to sign off on it as they wish.
Oh, okay. What would you recommend to someone who has maybe just a little issue with speech, with maybe just a small issue of swallowing difficulty or something along those lines?
So if someone's having difficulties with swallowing, definitely go talk to your doctor, because it's a sign that there's something going on.
Okay.
It's not there's other things going on, whether it's a general weakness, they've had a TIA, something is going on.
And a TIA is a transient ischemic attack.
Yes, it is. Sorry.
A mini stroke.
But in general, I like to train people in safe swallowing strategies. Small bites, take your time, alternate liquids and solids, so a drink of liquid after a couple bites of food. The way I generally like to put it as follow those good table manners your parents taught you.
Okay.
Is just don't rush. And take your time with it, and definitely let your doctor know, because we want to get you help for swallowing. Swallowing treatment, we can modify the diet, eat softer foods, avoid those more challenging foods like nuts and chips and dry things. Exercises to improve the muscles for swallowing.
Okay.
So this is your airway. Your larynx is part of your airway.
Right.
And then your esophagus is behind it.
Right.
If someone sounds wet, like they have a wet vocal quality, it sounds like they're talking underwater, it's kind of gurgly, that's a sign that there's residue sitting on their vocal folds. And it could sneak into the airway, which has caused aspiration.
Right.
Aspiration is a foreign substance that goes into the airway.
That leads to pneumonia.
Yes, it can lead to pneumonia. And if people are coughing a lot while they're eating and drinking, that's not normal. Okay. That's a sign of potential aspiration. And if someone, like if you have liquid that comes out of your nose, we can give exercises to help with that too.
Wonderful.
Yeah, it's very, because eating should be pleasurable.
Yes.
It's a social activity, and we want people to enjoy their meals here at Green Spring.
Wonderful. What is the difference, though, between speech and language?
So speech is articulation, the way the sounds are formed. Language is how you're putting all your words together, what you understand and what you can express. So sometimes someone has a stroke and they understand everything, but it's really hard to get the words out. They really struggle.
Right.
Or they talk fluently, but it doesn't make sense. So they're not understanding the message.
Okay.
And that's called aphasia.
Oh, right.
And so we want to help people with that.
And what kind of exercises, treatments do you do with that type of situation?
So those type of treatments, we want to make sure that, so it could be looking at objects, practicing naming picture cards, things in the room.
Repetitive.
Get repetitive, get the words flowing.
Okay.
And then with receptive language, following directions, things in the room, just pointing at objects,
Right.
checking, it's like, hey, I didn't understand you. What did you mean to say?
Oh,
Because communication is back and forth. It's not a one-way street.
Right.
And if you're communicating with somebody that's having a hard time, help them as much as they can. If they're trying to like, oh, I went to this place last Friday, where did I go? Help them, like, oh, did you go to the store? Did you go to your daughter's? Provide them some help.
Give them some multiple choices to choose from. Okay.
Like, oh, like I really like this type of fruit. And like, oh, well, what color was it?
Right.
Was it citrus? Was it a banana? Provide some assistance to help them communicate and let them, because again, it's a two-way street.
And don't get frustrated in trying to help them.
Exactly. Understand that we all have that situation at sometimes we can't find the words. I know I do. Right. And it's your friend, it's your loved one. We want to be kind and gentle, and we want them to show the same thing to us if we have those trouble.
Well, it certainly sounds like you're a kind and gentle individual.
Thank you.
And that you're providing a wonderful service to the residents here in regards to it. And we're so glad you're with us.
Thank you very much. It was nice to meet you.
My pleasure. And please come back again.
Okay.